When injecting lips, one question matters. Where's the artery? If you don't know, you shouldn't be injecting. In this video, I'm going to show you exactly where that artery really is, why so many injectors get it wrong, and how a true 3D understanding of lip anatomy can make your injections safer, more accurate, and more confident. By the end, you'll know the real danger zones, how depth matters more than angle, and how to use reference points that dramatically reduce your risk of complications. Let's get started. Most debates about lip injections are based on 2D models, but arteries live in 3D. Some papers say the artery is in the vermilion border, others say the wet-dry border. So which is it? Let's clear this up. So there are two important aspects to think about in your learning. What is the resolution of your understanding, and what is the 3D anatomy, not just the 2D? So let's make this real by thinking about horizontal versus vertical injections. If you think that a horizontal injection is safer because you tend to be pointing away from the labial artery, which is in the wet-dry border, as I've seen many injectors say, you're actually not basing that on 3D anatomy, because the artery is not in the wet-dry border and it's not in the vermilion border. It's actually 2 to 3 millimeters above or 2 to 3 millimeters behind both of those structures. But this isn't something that most injectors think about when they are in the debate between vertical versus horizontal, which is the depth. And that's a three-dimensional understanding, and that's where a lot of the confusion actually comes from. So let's have a look at the basic anatomy of the lip. I really like to look at it in cross-section. I think this is a vital way to understand the lip because it gives you the idea of depth. But then we also need to understand how those structures intertwine with each other. And this is where the 3D really makes things so much easier. If you have a look at this model here, you can see the different layers. We have the dermis, then this very thin layer of hypodermis in the top lip, which is often where we're trying to treat fine line wrinkles. Then you have the most important structure probably of the lip, which is the orbicularis oris muscle. This muscle has its origin actually on the maxilla or the mandible, and then it branches out from that, reaching in 4 different sections across to the modiolus, where the two sides meet, and that forms the biggest and the strongest part of the structure of the mouth. Underneath the orbicularis oris, you have the mucosa, and it's in this space that we tend to find the superior labial artery. So this is probably the bit that most injectors are most worried about affecting when you first start. Obviously, we want to get beautiful results, but you also want to avoid the artery. So when you look at the data on where that artery tends to lie, it's actually been quite well described as nearly always at a depth of about 4 to 5 millimeters typically. You can see where the muscle is relatively easily, because have a look at, once again at this diagram, and you can see how the orbicularis oris curves around and has an insertion point into the skin right where your vermilion border is. That's essentially what your vermilion border is the junction between the muscle and the two types of tissue, the white lip or the skin, the dermis, and your mucosa. That meeting point is a very important reference point when we start to inject, because everything is relative to that meeting point and the artery that lies underneath the muscle. We can use that in many different ways to inject more accurately. So in this diagram, you can see I'm showing how that position of the needle is relative to the insertion point. In fact, if I zoom right in, you can see how it has been slid purposefully underneath where the muscle is, which is above, and then into the volumetric part of the lip. So this insertion point is very, very important for accuracy. If you're inserting a needle directly into the vermilion border, you tend to be going through an area where there is a greater sensitivity. There are more nerves there, so it's more painful. And you're also sliding into the muscle itself, so there will be more bruising and potentially more complications and inflammatory reactions, some people think, if filler is embedded in the muscle as opposed to in other types of tissue. So this is why accuracy here makes a huge difference, and your understanding of the 3D. You can see in this image that I'm recording how much space there would be, and we did create these images to be to scale. So there's a relatively large amount of space on the average patient between where your entry point is and the depth of your needle, so long as you're controlled, and where the vessels tend to be. And you can see why it wouldn't really matter so much which angle you're entering in, because your depth is the defining feature that makes you safer. Should you aspirate when doing lips? Now, my position is that I tend to aspirate nearly all the time. I do it mainly out of muscle memory. But it is absolutely possible to do really safe procedures without aspirating, so long as you're doing other things instead. And it's really important to understand that it's not really about whether you aspirate or not, it's about the totality of all the different safety measures that you take. So something that happened last year, which I found really helpful, is to allow myself to be directed during a procedure by a very experienced injector. Many of you would have seen it. This is the live I did with Julie Horn, where she directed as she would do a pair of lips, according to the 8D framework, which I teach. So she designed the solution and I executed it. And then I unpicked what she was thinking all the way through the journey. So the example I'll share with you is when doing a vertical injection, I would stop injecting about 1 millimeter from the exit point of the needle. And she essentially keeps going a bit longer, which is actually where a lot of the gains are. So really, really useful to really unpick how injectors are doing things and then see if you can replicate that and improve your understanding. It's a never-ending process. We're never finished, but it's super useful. Hopefully you now know exactly where the real danger zones are when it comes to lips, how to visualize them in 3D, and how to inject more safely and confidently. If you have found this video interesting and would like more information, click the link below for details.